What is high-functioning anxiety? Honor students, excellent employees, leaders, and just about anyone who is used to performing at their best are at risk of experiencing high-functioning anxiety. A person who has this experiences a lot of anxiety but can still manage to do well at whatever task handed to them. It is a real experience, however, it still is not classified as a mental health condition. If you are wondering whether you may have high-functioning anxiety or just curious about what it is, then you have come to the right place. For today's inspiration calling video, we will be discussing the basics of high-functioning anxiety, its signs, and how you can cope with it. But before we even get there, help us grow our community by subscribing to our channel. This is a safe space to learn more about you, your personality, and anything involving psychology. Please don't forget to click the notification bell too, so we can notify you whenever we upload new content. If you're done with that, let's get straight into the video. Even if you are an overachiever and a competent good person, you are not immune to having high-functioning anxiety. You can be the calmest and most put-together person your friends and colleagues may know, but your mind can still be filled with anxiety, self-doubt, and the constant fear of failing. As a result of this, you try your best to perform well in everything that you do. You try to do tasks in a particular and perfect way to the point that you seem to fear losing control of things. This is just a portion of the struggles of those who live with high-functioning anxiety. It is crucial to identify and treat this condition even if it is not listed in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, since the signs and symptoms might impair a person's quality of life. Anxiety is a normal emotion when it doesn't bother you or make you feel uncomfortable. It can assist you in avoiding potentially hazardous circumstances, making plans, and maintaining motivation to finish activities. However, if you have high-functioning anxiety, you are like a duck resting gently on the water with your legs frantically paddling just below the surface. Even though you could come out as in charge and enthusiastic, you're really just trying to get through the day. A person with high-functioning anxiety usually has good organizational skills and strives to complete tasks on schedule. However, because they are accustomed to a level of anxiety in which all the physical and psychological symptoms are concealed, any additional stress could cause them to lose control or snap. Due to a lack of awareness or insight, people with high-functioning anxiety experience all of the symptoms in silence and are perpetually on the verge of burnout. Now let's go to the common signs and symptoms of high-functioning anxiety. Although it might be very difficult to spot them, especially if people are used to seeing you succeed, and you are also good at appearing like you are fine. Fortunately, there are obvious and telltale signs you can look out for. But before going through them, we would like to set a disclaimer. This video was not created to replace the diagnosis of mental health professionals and doctors. One video is not enough to cover all the complexities of any mental health issue. If you or someone you know suspect having high-functioning anxiety, it is better to seek the help of a professional as soon as it is available to you. This video is only here to help you educate yourself and others on the realities of high-functioning anxiety. Please do not use this to diagnose yourself or others. Now that we've settled that, let us now discuss the 11 signs and symptoms of high-functioning anxiety. 1. You've had extreme anxiety or concern for at least 6 months. 2. You occasionally become nervous or wobbly due to your restlessness. 3. After being under a lot of stress, you feel worn out or drained. 4. When things don't go as planned, you become agitated. 5. Your muscles are tense, causing you to tighten your hands and jaw. 6. You have sleep issues, whether you're not getting enough, waking up and having trouble going back to sleep, or having difficulty falling asleep. 7. You're jittery and on edge all the time. 8. You converse quickly and discuss several topics at once. 9. You struggle with task delegation and lack confidence in other people. 10. You have unyielding standards or are an unforgiving critic. 11. You turn to drugs or drink to cope. Although they are still able to operate and accomplish things, people with high-functioning anxiety may experience some of these symptoms. However, achievement that is motivated by worry comes at the sacrifice of overall health and wellness. This could lead to exhaustion, eventually leading to burnout and depression. Now, you might be wondering, how can someone get high-functioning anxiety? Is this something you are born with? Or is this something you acquire through time? To answer that, generally, someone gets anxiety and high-functioning anxiety because of their genes. It can also be because of their environment as well as what they have experienced while growing up. If you have any of these risk factors, then you are more likely to develop high-functioning anxiety. Having anxiety disorders in the family. A few bodily ailments, most frequently thyroid-related. Having grown up in a situation that could have triggered anxiety, such as having anxious parents or siblings. Usage of illicit drugs and alcohol. Shyness in childhood. Even with all these, we should remember that having high-functioning anxiety or any anxiety disorder in that matter does not mean you have to suffer while living for the rest of your years. Science and psychology has come a long way now. There are already a lot of practical ways to cope with it and even learn how to live without it bothering you so much. Depending on the degree, high-functioning anxiety can be treated in the same ways as other anxiety disorders, through therapy, dietary changes, and medication. If you have mild to moderate high-functioning anxiety, it is best to regularly exercise and increase your physical activity. You should not make sleeping late or irregular sleeping schedule a habit too. For you, having a good night's sleep will help in maintaining a good mental health. If you struggle with recurring anxious thoughts, you can also try using scheduled relaxation and meditation. This can help you distract your mind of what might happen and what if so that you can focus on the now and truly live life to the fullest. Since people with high-functioning anxiety are prone to work their head off just to produce a perfect result, it can drive them to having more fear and anxiety. As a way to combat this, you should figure out a way to be mindful of your workload and timelines. Avoid bombarding yourself with tasks and remember to take a break from time to time. You'll thank yourself for doing this for you. Using cognitive behavioral therapy, or talk therapy, along with prescription drugs can be helpful in managing symptoms for severe kinds of anxiety. An expert in behavioral health can assist you in setting objectives, understanding your anxiety, managing its symptoms, and understanding its causes. It is beneficial to use medications for anxiety disorders. These include long-term SSRIs, selective serotonin reuptake inhibitors, and short-term beta blockers and benzodiazepines. Despite knowing all those practical steps to help you with your anxiety, please do not deal with this alone. It may be hard at first, but seeking professional help while things are still not that bad will help you more than you think it would. You don't have to downplay your symptoms for the sake of your work or school. Besides, your achievements and goals will prove useless if your mental and physical health will be put at risk. Please do not think of overworking, not sleeping, and not resting as something to be proud of. Even while high-functioning anxiety is not a recognized diagnosis, it does not mean that nothing is going on in your life. Contact your healthcare practitioner or a behavioral health professional who holds a license if you are experiencing any of the symptoms listed above, including anxiety, burnout, or any other mental health issues. They can help you start on the road to recovery. That's it for today's video. You can leave any of your questions, suggestions, or reactions in the comments section below. We'd love to hear from you. Also, don't forget to hit that notification bell so you can get notified whenever a new video is up. Until next time. Thank you for watching.